And just within the first few weeks, it was like light bulbs going off left and right. This is exactly what I knew I didn't know. I just didn't know where to find it. And learning from them was great. They also really emphasize manual therapy, which is really where my background is too. But the thing that was really mind blowing to me about pelvic health and pelvic pain in particular is it really needs a multidisciplinary approach. When you deal with somebody with pelvic pain, you actually have to know so much more medical information. And I'm not a physician. And this interesting dynamic between physicians and physical therapists, like historically, it's yes, you're just the PT. But when you walk into the pelvic pain world, especially with societies like ISWISH and IPPS, they're very inviting and they recognize we can't do our jobs without you guys. And then it's vice versa. So it's not just musculoskeletal. It's so intertwined with other medical interventions and practices that, for example, sexual health. There's only so much I can do with the muscles when there's a tissue issue because of birth control, because of menopause, and that tissue's irritated. The muscles may be responding to the tissue. They may not be the primary driver. And that was a really big learning curve that really helped my practice and my ability to care for these individuals.
Hello, everyone. Welcome to the Life as a Patient Doctor. My name is Dr. Moss, and today I am interviewing Jandra Mueller, who's a pelvic floor physical therapist renowned for her expertise in pelvic health and a particular focus on managing pelvic pain causes. She holds both a doctorate in physical therapy and a master's degree in integrative health and nutrition. She brings a holistic approach to addressing the pervasive hormonal and gut issues intertwined with many healthcare conditions. She's the director of Encinitas Clinic in the Pelvic Health and Rehab Center and the director of internal and external education. She has been invited to speak at international organizations educating healthcare professionals about the importance of pelvic health. She has a particular focus on endometriosis and education to both patients and providers through co-developing a continuing education course focused on the management of complex endometriosis, as well as her podcast, I Care Better, Endometriosis Unplugged. Thank you so much for joining us.
Thank you, Stephanie. Dr. Moss.
No, thank you. I would love to just hear a little bit about your story and what brought you into medicine.
Sure. What's really interesting actually is many people that deal with certain conditions go into the field of medicine because of that. And honestly, for me, it was the opposite. I feel lucky to be in the field because it helped me understand things that came after. So a lot of people will ask me about, because I do have endometriosis, and now I've really gone down the deep dive to better understand it, and I'm really passionate about helping others. And it's because of the fact that I'm in the prime position to have the resources and be able to deal with it essentially, or get it handled and go to the right people. But I didn't even know where to go being in that position. So how in the world are people not in the medical field able to navigate this? And so that's how I got more passionate about endometriosis and taking on that specialty, teaching about it, educating about it. But it really started because I was already in pelvic health, essentially.
That is amazing. I very much understand and appreciate it because I also wasn't diagnosed with my own endometriosis until I was in medical school. So it was also like a secondary thing.
Yeah. So that's my story, is not because I had dealt with this to get in, but I didn't really know what I wanted to do. And I was always a big science person. I really actually loved school. And it was like graduating undergrad with kinesiology degree. I was like, what can I do? I have student loans. I don't really want to be a trainer. Not really interested in athletic training. So I talked to my advisor. She was a PT and athletic trainer. She was like, don't go into PT. I was like, okay. She's like, go to PA school. It's cheaper. It's quicker. And I was like, if I do that, like, I would probably just go to med school. And so anyways, I started working for a clinic, and I just really loved the biomechanical piece in it of physical therapy, just the human body and science. I've always loved physiology and anatomy, and had some really amazing professors who were very biomechanic savvy and heavy. And I just loved it. The woman I worked for as an aide was really into a lot of manual therapy. She was a really high level athlete. And so it was great learning from her. And so decided that's what I wanted to do. One of my rotations at the end of my PT school training, I did have the opportunity to spend some time with a pelvic health therapist, which I didn't even know existed because we really don't get it in school. And that still is pretty much the case. And was just like, this is what I want to do. So that's where it started 12 years ago.
I am so glad you had that opportunity to hear about it because, like you said, even in the medicine world, you just don't hear about pelvic PT. Did you end up doing formal training in pelvic PT after you got your doctorate, or was that kind of part of your training?
Yeah, it's not a formal part of our training. Luckily, I did have some guidance because one of our assistant professors, she also did pelvic health. So we had about a 2-hour optional kind of track when we came back to learn about it. And then I signed up for the continuing education course, Pelvic Floor 1 through Herman and Wallace while I was still in school. And so I went and did a Con Ed course while I was still in school to be able to do pelvic health. So I didn't work in a setting that was pelvic health related. I actually worked in a pretty high level sports and orthopedic clinic for 3 years or so when I graduated. But I was like, give me some blinds. This is my room. And I, on my own, did some pelvic health while there. And so I had a friend who was an OB-GYN who really loved pelvic health therapists and was excited to collaborate. So she would send me patients. And then I got more narrowed into pelvic health and ended up in the Pelvic Health and Rehab Center in 2016, where I really started the deep dive in complex pelvic pain conditions.
Can you talk a little bit about how this rehab and pelvic center, how it continued to grow, your passion and also learning about it?
Yeah.
Like other therapists there that you learned from?
Yeah. So Stephanie Prendergast is my mentor and good friend, colleague, and I have learned so much from her and the company as a whole. We have a lot of clinics, but we're a pretty small company. And so they really emphasize continuing education in regard to external, but also within. And Stephanie and Liz had an interesting introduction into pelvic health where most of us start with more basic things, incontinence, prolapse, like low tone disorders is what we call them, or they can be categorized in. But they actually started their careers with working for a urologist and started with pelvic pain, which is pretty unusual. Usually build up to that. When I was living in Hawaii, I ended up working for a women's health center through one of the hospitals there. And the focus was primarily on breast cancer rehab. So true women's health, or at that time, those born female at birth. But there was a lot of pregnancy, postpartum, and there was some pain. And it was really there that I started to notice there's something I know that I don't know, but it was really hard to find what that piece was in dealing with pain. And so the opportunity happened that a friend of mine actually said, hey, they're hiring. She knew I was moving back to California. And so when I first met Stephanie and just learned more about their practice, I read their book, the Pelvic Pain Explained book. And this is exactly what I'm looking for. And I don't think I realized it at that point. And so luck and timing, I suppose, that brought me to them. And just within the first few weeks, it was like light bulbs going off left and right. This is exactly what I knew I didn't know. I just didn't know where to find it. And learning from them was great. They also really emphasize manual therapy, which is really where my background is too. But the thing that was really mind-blowing to me about pelvic health and pelvic pain in particular is it really needs a multidisciplinary approach. When you deal with somebody with pelvic pain, you actually have to know so much more medical information. And I'm not a physician. And this interesting dynamic between physicians and physical therapists, like historically, it's yes, you're just the PT. But when you walk into the pelvic pain world, especially with societies like ISWISH and IPPS, they're very inviting and they recognize we can't do our jobs without you guys. And then it's vice versa. So it's not just musculoskeletal. It's so intertwined with other medical interventions and practices that, for example, sexual health. There's only so much I can do with the muscles when there's a tissue issue because of birth control, because of menopause, and that tissue's irritated. The muscles may be responding to the tissue, they may not be the primary driver. And that was a really big learning curve that really helped my practice and my ability to care for these individuals.
I love that. It is so comforting to hear other individuals that are passionate about that multidisciplinary approach, because it is so important. Us as a single person cannot know everything. Even if you get your doctorate, there's no way. You don't have infinite time in your life.
And on that note too, it's also our system, how medicine has been so compartmentalized that patients will tell me something that comes up regularly is, can't my regular gyne do this? And it's, yes, they have the ability to, but unfortunately, where the research is for XYZ is in the sex med journals or the urology journals. And those people also have families. They're also on call delivering babies at who knows when in the middle of the night. They're not going to go home and do all their requirements that they need to keep their license with their societies and then say, let me just pick up the journal and see what's new. And so the information isn't always available, and it's not their fault. It's partially how our system is set up.
Makes such a good point. And looking at a work-life balance approach is so important, especially for us as providers. I'm interested how learning about physical therapy and working with other providers also impacted yourself and how you even took care of your own body.
Yes, the work-life balance is hard, especially with complex pain conditions. I will say it's also interesting that I decided to do physical therapy because when I was 17, I totally blew out my knee. And it was pretty bad. I had a really terrible PT experience, actually multiple. And it was very basic how it was taught, a modality based. Okay, I'm going to go in. Here's my hot pack, my cold pack. Let's do some therapeutic ultrasound and e-stim, and I'll move your kneecap around a little bit and do some quad sets and good to go. And I was like, this is no. So that was my experience of PT. And it wasn't until I was a PT that I understood, oh, it's so much more. And there's so many different ways you can approach healing and rehab. And that opened my eyes a lot. But essentially, just figuring out what I liked to do and moving in general. And it doesn't have to be so regimented. I'm not a gym person. I'm trying to go back to the gym, but more movement in general, activities. I lived in Hawaii. I loved hiking, surfing, salsa dancing, which I love doing. So those were more of my release techniques. And having endo was hard in that sense, as many people can imagine that have endometriosis. It's hard to want to move when you don't feel good. Luckily, mine was not as painful per se as others. It presented odd, more GI and immune system. Like I felt like I was getting the flu, but I didn't realize, or in COVID, I started noticing every time I was taking COVID tests, it happened to be around the same parts of my cycles. For me, it wasn't so much a pain issue. It was more like I literally have a fever, low grade, and the symptoms that really take you down. And that makes it hard to move. Sometimes I'm like, maybe it would be better if it was more painful versus feeling sick, but grass is always greener on the other side.
I'm glad you talked about the other symptoms of endo, because I think with the lack of education on women's health conditions, especially in medicine, sometimes the box that we put for endometriosis is only dyspareunia, sexual pain, and there is so many other, when you're talking about the GI tract, the immune system, physical body not being able to function, the cognitive, it really is whole body.
It is.
I'm interested if during your medical education or during post when you've been working, have you suffered any challenges from your health condition and ways that you were able to overcome them?
I think the biggest challenge is going to new doctors and marking those boxes of previous health conditions. And when you know so much about something and you treat it, and then you go to just generalists, essentially, even specialists, but in other forms, like even a gynecologist, I literally think, do I check this? Do I even list it? Because I don't necessarily want to hear what they have to say about it, especially if I'm not going there for that. And so I feel like that has been really challenging, not so much in how it impacts my work, but just life in general, and knowing as a provider and knowing so much more about this condition, like so many other patients who are not even in medicine know about their condition, and trying to educate their providers because of the misinformation or the lack of knowledge and training in that. That's always a hard one to go into. And I just have to tell myself, Jandra, just be quiet. Just sometimes they're happy to learn more about it, which is great, but that's not usually the case. So I feel like that's been a really interesting challenge as a healthcare provider who has one of these conditions.
That's a really good point. And I don't think we've talked about that enough yet on the podcast. The going to a doctor and knowing about your own body, but then also the research you've done on your own time, plus actually working with other patients with that health condition. It is a challenge.
Yeah. And not just with endo too, but I think a lot of the hormonal aspects that we know about being an ISWISH, right? And how many doctors are still telling patients, be careful with the estrogen, breast cancer, or no, that doesn't work, or your birth control isn't causing this. It's minor. It can't do that. And when we just know that's not true, because again, they haven't had that training or information. So they're only working with their knowledge base, which again, if somebody is really open to learning about that and hey, have some resources, which also many have, but many have not, or they're not that interested. It's not their particular field. I had one doctor. This was interesting. I had some mast cell stuff going on, and I found somebody who was proclaimed to be one. And he was helpful for sure in the beginning. But when I brought up there is a connection between endometriosis, all these other things, I said, is there anything I should be aware of, or I'm happy to make an appointment with you to talk through some of this stuff, or what should I be looking out for? And he basically said, this is beyond my interest. I have that in a my chart message documented. And it was like, how in the world? Because this condition is so connected to so many other things, and to just say it's beyond your interest when you're a specialist in that field, like that encompasses so many other things, was pretty disheartening.
That does sound really painful. I'm sorry you had that experience. It's really hard to hear when other health providers are dismissive or just not able to provide emotional support that they just don't have.
Yeah. Not even so much emotional support. Fine. Like, you're not a therapist. I don't want to expect you. But yes, to not recognize that actually this is within your wheelhouse, it just humbles me a little bit to recognize, like, what do I say or do that may come off differently or not well to other people? And my intention is not that, but I'm sure that all of us do that. So those moments make me reflect a bit too. So it's a learning experience.
Exactly. That is such a good point. Having a negative experience with a negative provider, looks at yourself and like, have I ever done that? And then puts a little thing in the back of your mind of, okay, I'm going to be more careful so I don't cause someone else to feel like I'm feeling. I associate that as a commonality. Like even just with gaslighting or saying pain is normal. And if someone tells you that, no, pain is not normal. Yeah, there are so many things.
It happens all the time.
Exactly. It definitely takes energy to be able to step away from just the bias. Doesn't make it any less painful for someone who's actively living it.
Yes.
What are your thoughts on breaking stereotypes and bringing more individuals who have health conditions into the medical field?
I mean, I think we all end up with something, right? Like, it's very rare to not have anything. Maybe it's related to the field you work in, maybe it's totally unrelated. But I think just finding an environment that fits you, because you don't need an added stressor of something that is not working with you, that you don't feel supported in or have the balance that you need. I think we're all going to go through times where things are really stressful and it's busy. And there's, of course, going to be challenges always at any environment you work at. But I think finding a place that understands or takes a curious approach, not just assumes things about you, and you have that ability to be okay sharing or not sharing what is going on, I think is really important. So there's so many places you can be and settings you can go to that if you're miserable at your job, it's not going to help you at all. And that's something that I've been very thankful of. And being with PHRC, I went a year on my own, not because I really wanted to, but I moved to San Diego. They didn't have a clinic. And I realized like trying to run a practice was not for me. To truly be the business owner and all of that, like I loved helping and being part of that, but I didn't want that. I loved the support. I loved the community. And we ended up coming back around after that year. And just that's how the Encinitas office came to be. And I explored it. It was not for me. Yeah.
That's great that you were able to notice that for yourself and be okay with it, that there are different positions that you might be good at and you might not be good at, but it's important to find what you love doing. As we start to wrap up, I would love to hear any pearls of wisdom and advice specifically for any medical professionals, either current or even as students, so future, who are living with health conditions as they're going through their training or their work.
Yeah, I think for all providers, whether you're in school or you have been working for 20 years plus, or you're brand new into it, I think having that curious mind is really important to sustain. And I think as you get more specialized as well, like you have a niche area, it's great because you know a lot and it in some ways makes you prone to not coming back and thinking outside the box or considering other scenarios. Medicine always changes and evolves. And I think we need to really appreciate that and just stay curious. There's stereotypes. Usually with these symptoms, it fits with this, but there's always going to be outliers. And I think remembering what works for you, obviously, you need something that helps you guide your treatment and care of individuals. But when the things that you know should work aren't working, really be curious and think what else. And just listen to your patients too. That goes for everyone. I think your patients oftentimes can tell you what's going on. If you really take a detailed history, you're truly listening to them, they're going to give you a lot of answers that they may not be able to put together, but it's in there somehow. And I think that's really going to help you get far. I go on these deep dives because I see something I'm like, I wonder if there's any connection. And Google is a tool. It's not always the best tool, but it's a tool. And so that's something that I've done and found super helpful in being able to connect the dots more. Then I end up finding something I never heard of. And then I go down that rabbit hole. And then sometime in the future, a patient presents with something, I'm like, I recognize that. So staying curious, listening to your patients, and for the newer students that are going into medicine, whether they're in med school or undergrad, wherever they're at, this generation is going to be so much better about asking questions and pushing boundaries and questioning things. And I think keep doing that because those of us have done it for a long time may have lost that a little bit and need that energy.
Thank you. Stay curious, listen to your patients, and ask questions. Those are great suggestions. And I hope that it also can inspire others to show that it is possible. You don't have to have a physical, mental health condition to prevent you from doing what you love. Jandra, you mentioned so many amazing resources of places that you've worked and organizations. You mentioned ISHWISH, which is the International Society of Women's Sexual Medicine. I think that's where we met the first time when I was at a conference a couple of years ago.
Watching a poster presentation. And I remember your textbook, because you have it, because now textbooks are on iPads and computers. That's different. But there was like, what, 2 sentences on endometriosis, and you're in that segment, which is crazy because it's probably one of the most common gynecologic or pelvic pain conditions that exist. So that was interesting. But yes, International Society for the Study of Women's Sexual Health. It's a mouthful. So ISWISH.
That's one. I love it. Yeah, that's one. Oh my goodness. Yes, I remember that. Because it's just a little paragraph that just says a couple symptoms, a couple treatments, and you're good to go. And not the most current. You talked about mast cells that recently came out of a possible symptom.
Yeah, I think it's related, and we're trying to understand how. There's a lot of like immune factors that are shared, and I'm sure that they are different diseases, but can it be presented as a piece of it, or does that activate one versus the other? And yeah, we're starting to learn about some cool connections. But
oh my goodness, yes. You reminded me that the group that you have, the Pelvic Health and Rehab Center, you guys have this whole online videos, don't you? Do you want to chat about that? Because I remember when I first noticed it, I like immediately put it on my website on the resource center because it's low cost physical therapy. That's amazing. Pelvic physical therapy and virtually.
Yeah, so PHRC, we do offer telehealth sessions. I do them, and then Liz and Steph both do them as well. We do really think patient education and provider education is very important. So we do have a weekly blog that comes out about all things pelvic health. We do have our YouTube channel that has a ton of different videos and that are both provider and patient facing. I know I've met tons of providers who they've learned a lot too. And of course, we try to post on social media. I'm not a huge social media person, but try to be better. So I hide behind PHRCs. But yeah, lots of great information. We haven't announced it yet, but I'm sure by the time that you post this, we will have. But we are hosting a fundraiser at the end of the month in support of tight-lipped Riley Hooper, who is making a film about neuroproliferative vestibulodynia. We're having a patient-facing event, and we are hoping to have a provider event later on in the year. But Q&A with the specialists, all the proceeds go to these groups, which are doing amazing things in the world of pelvic pain as far as awareness goes. And so we love doing things like that. And I have partnered in collaboration with I Care Better, which is trying to provide more objective information about various surgeons that you can go to that are video vetted for excision surgery. I have always wanted to run a podcast, so I started that last year, and we did a ton of weekly episodes, which was a lot of work. So we are still having episodes. They're just coming out more slowly, all things endometriosis.
I can't wait. Oh, that sounds like such amazing things that are happening. I think that's where I reached out to you. It was after one of the tight-lipped events, because I'm also part of tight-lipped. I'm part of their medical student, or now medical team. And so I love that. And so I'll definitely be seeing you there on those patient and also provider events. That sounds so much fun.
Awesome.
And then I'll make sure to link them all below, but then I also already include a lot of the ones that you mentioned on my website on the resource page. I have a section for podcasts, so I'll make sure that one's on for the endometriosis. And then I have, all the videos. So I'll make sure to also share that, because I think it's so important to talk about education, not just for patients, but also providers. It's all the combo. I love that. I know you mentioned you don't do social media, but is there any other way that people can contact you if they want to learn more or talk to you?
Sure. I am on social media. I am at Pelvic Health SD, but if you want more consistent information, at Pelvic Health is where you can find us and me. That's where we do most of our stuff for the company. Yeah, follow the podcast as well.
Yes. Oh, definitely. I want to thank you, Jandra, so much for coming on and sharing your experience, both as a patient and as a doctorate of physical therapy. It was wonderful to hear your story, and I can't wait to collaborate in the future and keep hearing how you're changing the lives of other individuals. Thank you so much for all your work.
Of course. Thank you so much, Stephanie. Dr. Moss.
Take care, everyone.